care, stoma care, stoma irrigation, and applying and reapplying, removing and reapplying ostomy appliance. So supplies-wise, 2 to 3 washcloths, 2 to 3 towels, red biohazard bag, a stoma measuring device, scissors, clip, new ostomy appliance. You'll need the wafer and the bag. We're short of bags, so we're going to have to use the bag off of this patient. Set a marker and that's it. We'll do the irrigation later. So, for your checkoff, when you come in, you'll remove the student's ostomy bag appliance that was on before you. So that'll be your checkoff on that. So, first, what we want to talk about is you'll come in, you'll introduce yourself to the patient, just like we do any other time. The only thing is that now we're adding the abdominal assessment. From here on out, every skill that we'll do, we have the assessment. So you do the abdominal assessment that Ms. Voss just spoke with you with. Bowel sounds, it's important. 1, 2, 3, 4 in that order. Okay? So, good deal. Alright, I'm going to use both abdomens here. So, you come in, after you assess that, we'll remove this. You'll get one wet washcloth. That's what basin of warm soapy water. So you will dip this washcloth and you will use that to remove this old ostomy wafer. Okay. As you wet it, it will saturate and it will make it a little bit easier to come off of, and it helps protect the skin underneath. So we'll moisten it and we'll kind of walk that up. When we remove it, we'll remove from the outside in, working towards the center of the stoma. We'll remove the outside layer first. Alright, so now the inside layer will still be stuck. You can do that, or you can go ahead and wet it, let it sit in. That way it's kind of saturating through. While that's still going through and making it moist so it comes off easier, it doesn't do as much damage to the skin underneath. What you can do is take your bag or your basin, or probably a cup that's measurable, has measured markings on it, and you will take this, and with gloves on before you start, sorry about that. Alright, of course we put gloves on. Alright, you will take your clamp off, save your clamp. You'll probably be reusing it. So, and then you will empty the contents of the bag into the collection container, basically just milking it out. Now, once you get it emptied, you will take your clamp, clamp it off again, dry it off, and then you would dump that, okay? Now, you would note the color, the consistency, whether it's formed, whether it's liquid, whether it's semi-formed, whether it's brown, whether it's green, whether it had a foul odor, whether it had no odor at all, whether it had blood in it, whether it looked like it had blood clots in it. We get the picture there. Pretty much everything that stool looked like. Okay? Now, this is probably pretty moist now, so what we'll do is that since we've either, one, already worked the outside edges up, or two, we just moistened it, now we'll pull it up from the outside inward, and then remove it. So we would take this, and it would go in the red bag. Okay? Now I would have my red bag open, and as I put it in, I would probably go ahead and take my clamp off while I had it in the red bag, and then take my clamp and set it here. Okay? It'll always be a fresh red bag, so it's not a big deal. Now, I'm going to remove this so I can use it again. Alright, now once we pulled that off, the washcloth that we had, or whether we would use a new one, let's just say we would use a new one. Once we pulled that off and we put this here, we would take a folded washcloth over the stoma. Now the reason for that is that ostomies can be anywhere in the intestinal tract, normally from the end of the small intestine, the ileostomy, up all the way around to sigmoid colostomies. Okay? So, if we have one at the end of the intestinal tract, what do you expect to come out of it? Harder form of stool, and not as frequent. Whereas if it's down here, we're looking at continuous liquid stool. So as we're trying to change this, there's a pretty good possibility that it may just try to drain on its own continuously. Well, the reason we're not necessarily using a wet one is that as that drains, then it'll soak up into our washcloth here, soak into the washcloth instead of hitting it and draining down. Okay? So, we've got this on here. Now, once we did that, if we didn't do it before, which it's okay to do before, okay to do now, go ahead, let's lay a towel down here, and let's go ahead and let's lay a towel across the patient's sheets. We want to maintain as much privacy as possible, even while we're doing this, because the dignity of the patient is a big deal. Obviously, they have an ostomy, especially if it's newly formed. Some people see this as the end of their life. The self-concept goes all the way down to the gutter, and it's a little understandable. I mean, it's embarrassing, but it is a part of life. So, anyhow, we have this covered. So, what we'll need to do is we'll just go ahead and we'll get ready. All right. So, as we have it covered, I would go ahead and get me another washcloth, dip it in soapy water, and we're going to start prepping the skin. So, we want to clean the skin around the stoma, removing any residue. We want to try to get everything off, but we don't want to be so abrasive that we're breaking down the skin and we're basically just tearing what skin there is off there. It's already going to be a little sensitive because we put something on it that's abnormal, and there's a possibility that it may have little feces on there, which is already degrading the skin integrity, so you have to be a little cautious. Once we basically clean the outside, probably want to rotate that rag, and we're going to clean the stoma itself around the edges. Now we want to get any kind of feces off that's on there. It's okay for the stoma to bleed a little. When I say a little, you may see a few drops here and there. It's basically like you're washing the inside of your intestines. So you can imagine that, you know, it would bleed a little bit if you were doing a good job, but you don't want it to be where you're scrubbing and it's just a bleeding, and you're just a scrubbing because you're doing such a good job and it's still just a bleeding. So be gentle, but you do want to get it clean. So if you notice that it's starting to bleed a little bit, it's probably time to stop scrubbing. Okay, I would just lightly work around it. You shouldn't have to do much. Okay, so once you have good clean skin, put a rag back over it. Okay, maybe even a new one. The importance of this is that now we have this clean, we have it prepped, we have it ready to go for our next appliance. What we don't want is to spend a whole lot of time measuring, cutting this appliance and coming back and doing this and then having to clean this all over again. One, it's taking a whole lot of our time. Two, it's embarrassing for the patient. And three, we're breaking that skin down even more. So leave that there, maybe even change out the other washcloth, and that's part of the reason that we keep the washcloth on there. So we'll get rid of this one. All right, we'll have our wafer out. These are different depending on the manufacturer, which will pretty much depend on whatever hospital institution that you're at, or your clinicals, or wherever you work. Most of them come in either one-piece or two-piece bags. The one-piece bag is about the same as a two-piece, other than it's one piece. It doesn't have this snap part. The ones that we'll be using will be a two-piece bag, so you have the wafer and you have the bag itself. So they go together, snap them firmly, make sure that it's snapped all the way around. Okay, so measuring devices, before we put the bag on, we'll measure the stoma around it. The ones that you have for your checkoff will probably be these. It just depends. We want y'all to have something where we can kind of make sure that you're using the right one. What you'll see outside of here is just stuff from different manufacturers. I brought this one because I want y'all to see the wide variety that these things can come in from holes. Most likely that one's a fish too big. You know, you're looking at a whole lot of different sizes there. So, and this is what most people use nowadays, is a transparent measuring device. So I'll teach you how to use all these. So the one that we will, let's do that last. The one that you'll use for school, you remove this, too small, too big, too big. We'll say that this one's right. You would use this one. Okay, obviously that's too big. Why is that too big? What are we looking for size-wise?
Looking for a good
Pretty much. Anybody give me a measurement?
It's an 8. Is it an 8?
Yeah, you want no more than 1/8 of an inch of skin sticking out. Okay. The reason is because feces is getting on here. That will erode that skin away. So basically, you're making a wound around it, and that's going to make it hard to change thereafter. So you're creating a problem. Now, what we don't want is that it's so tight that we're just cutting into the edges of that stoma there, because then we start eroding the sides of it, and basically we get areas like this. Okay. So bleeding, irritation, hard on the stoma. You know, you want a snug fit, but not too snug. Okay. You don't want to see extra skin there in between, but I mean maybe just a little pinch, 1/8 of an inch. So use this one. Magically, I think it's going to be this 38 millimeter here. Would be the best fit. No? There we go. 35. So 35 millimeters. I mean that's pretty good. All right. If we were using one of these, the advantage of living in the new world is that you take one of these clear ones, and it's really quick because you can move this. You can look at that. Now, not all stomas are nice and round like this. They come in many forms and fashions. Maybe kind of football shaped, maybe kind of oval shaped, maybe kind of oblong. I mean, but they should be primarily about like this. Okay, so if you were to look at this, you would say, oh well, I can go at about 3.5 centimeters. All right. Well, most of them that you'll see today are nice enough to have these markings on the back of them, like this. Whereas if you see this and you say, well, it's pretty much 3.5 centimeters in diameter, we can just cut on that 3.5 centimeter line, and you go and you're pretty much right on. So if you don't have that, what you would do is you would lay this down, you trace around it, and then cut that out. Put that on your ostomy wafer, and then make that line around it, and then cut on that line. Okay? So, we're going to use today this, because I found that that's the best fit. So, I would put the size that I found it to be, and this is what y'all do for your checkoff. You'll measure it, and then you'll come over here with the paper one, because I don't think we'll have enough of those. You'll center it to that appliance, and then you'll take your marker and you'll mark that circle. Put it back in your pocket. Alright, now with the scissors, what we'll do is that when we cut, You'll cut straight up. You will not go all the way to this line, because if you do, it makes a rough edge right there where those scissors stop. Alright, and then you'll basically just kind of work up to that line. That way that there's not a rough edge, and you kind of worked into it. Another way to do it is basically just to start in the middle, and as you cut, just kind of work your way out like the Yellow Brick Road in The Wizard of Oz.
Stop, pull your enema out, and reassess put them back on their back.
But the advantage of that is that there's no sharp edges anywhere. It's just one smooth, continuous cut, and you're decreasing your risk of irritating the outside edge of that stoma. Alright, so we got that out. That's now we'll look for any call them hangnails on this, any jagged edges. Alright, now when you take that, you'll take and you'll rub the inside edge to kind of lay that down so it's not rubbing. There's no sharp spots. Once you've got that pretty well rounded down, you'll take your bag. Now, if it's continuously spilling, I would advise going ahead and putting the clamp on. If not, I would leave the clamp on, off, and kind of fold the bag up. Okay? That way that you can depress air while you're fitting your appliance. So, snap all the way tight. Make sure it snaps tight, because you don't want to have to try to snap it tight once it's on the patient. That's almost physically impossible. And as you press, your stool will come back out and complicate your problems. So you've got this good, fitted, ready to go. Now, in one quick motion, pull it up, look at it, make sure it's a pretty good fit. If it is, lay it back down. Alright. Take that, this is a sticky edge. Obviously, as y'all can tell, I'll let y'all feel this. Hopefully the ones that we have for y'all to check off will be a little bit better than that. I can tell you right now, none of the 4 of these that I've stuck today will have stuck, and this one's not going to either. So it makes it a little difficult to teach with. So, alright, so you pull it up, look at it, and you'll go down. Now, once you get it on there, you will kind of lightly walk these inside edges around that stoma, and it should seal off. You won't have any problems with it rolling up or bouncing up like the one that I'm doing now is, because it doesn't stick. Alright? So, once you get that down, I would say that you're pretty clear to depress that air out. And put your clamp on, and then come back. Since you know that you've got a good tight seal on the inside, now you'll grab this outside edge here, have this up, and work from the inside out. That way any air or wrinkles, you're getting them out, because any of those air bubbles or wrinkles, they're opening you up for a small tiny place to leak, which becomes a whole nother change. And stool and feces on the skin, which is detrimental. So once you get one side, you come back and you roll the other one in the exact same fashion, walking it along inside to outside, trying to ensure that you don't get any wrinkles or any spots, and just work it. Make sure it seals off good. Now you don't want to press down hard on either place, because once again it makes it come out. Alright? So, make sure we're going through what we needed to go through. Alright, so burping the bag. Most likely anytime that you dump it, you need to go ahead and burp the bag. Or if the patient produces a lot of gas, this is basically like creating a new rectum moranis, okay? So they have flatulence, just like anything else, gassy foods. That's where some of the teaching comes in. If the patient's having a lot of gas, maybe you need to talk to them about gassy foods. Maybe we need to change some medication to prevent some of the gas, okay? But either way, these do produce a lot of gas. So what you'll do is I would go ahead, and if I'm taking this off to burp it, I would go ahead and empty it too. How often are we going to dump this bag? 1/3 to 1/2 full. It'll never get over a half full, preferably at a third, okay? So keep our clip here. We could dump it if we needed to. If not, it may just be full of air. That's not abnormal. To have no stool and full of air. Especially right after surgery, you could probably expect that, okay? So what you'll do is that you'll lightly walk that, well, one, turn it away from the patient and not right in your own face, but away from the patient for their own dignity. Probably want to ask if there's any visitors to leave the room, because it may be it may have a pretty strong odor. Turn it away from them. Easily walk that gas out. Once you get it out, keep it depressed, and you will put your clamp back on. If there was any liquid, you would clean off this outside edge to make sure that it's not getting on their gown when you get done. Lay it back down. If you had stool in there, measure it, note the consistency, the color, all that, and dump it. The gas, not a whole lot you can chart on it other than, you know, I would estimate about how full the bag was full of gas and if it had a strong odor. If it does have a strong odor, there's different deodorizers and stuff that you can put in these that will help cut that out. That's important for the patient's dignity, because they may have visitors and stuff. So always keep that in mind. So, and when we place one of these, all right, if I am an ambulatory patient, meaning that I'm walking, we're going to place this facing down, because gravity is going to help this go down. All right. Now, if I'm bedbound, or I spend the majority of my time lying, it needs to be turned sideways. Okay. All right. So that covers that. Now, irrigation. What we'll do for irrigation is, like Ms. Voss taught y'all about the enemas, it's about the same concept, so we won't have to spend as much time on it since y'all have already had that. Alright, if the patient's ambulatory, what you want to tell them to do is get over the commode. If they can't stand over the commode, have them sit over the commode. Mainly where the fluid, the irrigation fluid, can run down and go into the commode. Alright, you'll hang this high, fill it to whatever has been ordered. Okay, higher you hang it, faster it runs. Lower the lower you hang it, the slower it runs. Okay, so prepare your fluid. Make sure it's not too hot. Make sure it's not too cold, because it could have some cramping, just like the enema. So you will take it and you will insert it into the stomach. You do not want to press very deep. If you meet any resistance, obviously you don't need to go strongly forward, okay? But as you flow water in, it will flow out too, so that's why it's important to stay over the commode. And if the patient's in bed, I would advise multiple towels and having a basin where it could drain, okay? I guess for our checkoff, we'll do it right directly to the stoma, okay? Or you may explain that process with the bag but not remove it, so that the next student can remove that bag. Now, if I was going to irrigate somebody, I would do it right before I changed their bag, or unless it was ordered some other way. But I have seen it done this way, and I think it's probably one of the more logical ways, is that if you're going to have to change the bag itself, then in order to funnel that out, especially if the patient's bedbound, you take this bag and you can clip. Now, remember, this is not for your checkup; it's for your own. Yeah. So, clip that bag right there, widen it just a little, take your funnel and go through and go right in. Okay, and then as you irrigate, it goes in. You keep this tight. It's pretty much like a closed system, and it runs out your ostomy bag. You put a basin here, and you've got a continuous flow. I mean, that's probably the cleanest and best way to keep the patient from getting super soaked. All right. So we did irrigation. I believe that's it. Now let's talk